Namaskar, this is Dr. Hema Divakar for Health for Her channel, the playlist on pregnancy care. What to expect when you're expecting? This is one of the most popular books in the market, which you may have read it as well. But in the Indian context, when you visit your doctor, there are several things that come to your mind which are very special to our cultural background, our dietary histories, what we like to eat and what not, the kind of myths and misconceptions that one would have on how to conduct oneself during the pregnancy. Well, this video will explain to you in very, very brief terms what your doctor is likely to do when you visit her during the course of your pregnancy. 4 pregnancy checkup visits are a must. The early pregnancy visit to confirm and sort out the routine problems that one may have, in addition to threatening problems like bleeding and a pain, if necessary, which would require further care, investigations, and treatment. A scan at 12 weeks of pregnancy to rule out genetic defects. It's called the NT scan. It's also coupled with a couple of blood tests, inclusive of the thyroid, the blood group, the RH typing, the hemoglobin, the glucose challenge test, the VDRL, HbSAg, HIV, and the rest. The blood pressure checkup will define your primary status of being having a normal blood pressure or a normotensive, as we would call it. So once this landmark or milestone is established, you move on to what we call the second trimester, the 4th, 5th, 6th month of pregnancy. Here again, at the 6th month, you will have another major scan, which will check out on the development of the normalcy of all the organs within your baby. By this time, you would have started having the movements as well. Once more, the glucose challenge test need to be repeated, and if your hemoglobin was low initially and the doctor has given you the iron and calcium tablets beyond the folic acid, which you will anyways take pre-pregnancy in the first 3 months, then you will need to step up your iron or take an injectable iron, and be sure that you're taking enough quantity of proteins for the better growth of your baby. So nutrition plays a very, very important role, and the activity, all accustomed food and activity are allowed, and it is better to be on the move rather than have a restricted activity unless specifically your doctor advises. Well, then you're marching ahead with the last trimester, the 7th, 8th, 9th month, counted down to the delivery process begins in your own minds, and the family is also anxious when, how, what, and where. So you have to choose the center where you will deliver. And if you are a complicated pregnancy, it's always better to be under the care of specialists, where an expert ObGyn and an expert neonatologist or the child specialist is available. The intensive care units, both for the mother and the baby, are available. This is required in maybe 5% of the cases, but those 5% will have to be very cautious and careful and plan their delivery in a place that is appropriate. But most other cases, if you're well managed throughout the pregnancy, you're least likely to have any unforeseen complications during the delivery, and the mode of delivery will be chosen in discussion with you by your doctor, depending on how favorable and how safe it is for either a vaginal delivery or an assisted vaginal delivery, in contrast to the C-section that you may have. Post-delivery care is also very, very important. And in terms of the breastfeeding, all know that breastfeeding is the best feeding, and you must initiate it within 1 hour of delivery, whatever mode of delivery you may have had, either normal or C-section. The immunization for the babies is a must. And in India, during pregnancy, the influenza vaccine, now the COVID vaccine, and the 2 doses of tetanus and diphtheria pertussis vaccine, Tdap as we call it, is also a must. All these are protective preventionary precautions so that you don't get into trouble. Comprehensively, if you keep your mind free of anxiety, we are quite sure that your doctor will guide you and sail you through a healthy pregnancy and an awesome outcome at delivery. Namaskar, this is Dr. Hema Divakar for Health for Her.